In looking at what occupational therapists do, I find myself asking, what is occupational therapy? So we are in the business of really sustaining or facilitating what we call quality of life through occupation. So what OT does is, with our knowledge, the arts and science and the knowledge that we have in human performance, we take everyday occupations, from the most mundane of making coffee, having the ability to do your bed, having the ability to walk around the house and care of your children. We take that in the face of any disability or any transient, even illness that incapacitates you. We take what is meaningful to you and we analyze it to make sure that you're able to continue to perform those occupations safely, that you find meaning, and therefore quality of life.
People find meaning, they find engagement, they find a bit of self-confidence when you have that independence to be able to do what you need to do without help, right? So without help might look different depending on what your disability is, what your cognitive abilities are. For someone who doesn't have use of their legs, only needing one person to help them out of the bed in the morning, rather than two people, or rather than using a mechanical lift, that is independence for them, right? It makes it more accessible for them. So an occupational therapist help individuals make those things accessible again, right? And I think that that really speaks to your mental health. And I think especially now with the way the world is, your mental health and the meaning that you attach to what you do in your life is so important. And I think, yes, OTs work quite a bit on the physical, adapting physical environments, adapting the way a person might move physically, improving it or changing it. But I think what it comes down to is that mental health piece of how important it is to move, to be independent, to have access to what you want to do. And especially now, your mental health is so important, and nothing helps your mental health more than access and independence, and that's what occupational therapists do.